We're going to move on to administration item number 2, COVID-19 update.
Because I believe people should have access, but I also believe that the vaccine's a choice, right? And people can make their own decision whether they want to get vaccinated or not. I guess some issues that are concerning that I'm hearing now is that the federal government's deciding to go door to door and basically press or advocate or, I don't know what else. I mean, we had a local school board member that wanted to tie access to education based on if kids are vaccinated or not, basically. From your standpoint, have you heard of them wanting to come in and do door-to-door advocacy for the vaccine? Have you heard that yet?
Well, other than the national news that you've heard, I've not heard that in the state of Florida.
And do we have any plans? Because I had people ask me about that. Do we have any plans to do that?
Well, I have plans to try to be accessible and available at neighborhood levels wherever I can be. But you're absolutely correct. Vaccine is a choice. And as I said earlier, my goal is to try to provide as much data and education as I can so people can make an appropriate choice.
Well, but there's a big difference between a neighborhood basically raising their hand and saying, hey, we want to have a vaccine clinic at our local clubhouse, and people can go there if they want, rather than actually going to people's homes, knocking on their door, and trying to press them to get the vaccine. We don't have any plans on doing that, or is that right?
I'm not staffed for that and have no plans for that.
Okay. I just want to make sure we're not using any county resources to do that, because I would not personally be supportive of that. Again, I think the vaccine needs to be available. People can opt into it. People can go to it. But I'm not crazy about the idea of pushing it on other people. So, all right, thanks, John. And there was an editorial today, actually, on the vaccine topic, which the Herald Tribune ran, that I frankly couldn't disagree with more. And, they're basically urging employers to hold out employment based on vaccine status, which I think is a pretty extreme position, that we should want people to go back to work and be productive rather than dangling, employment and a paycheck for their family over whether they're vaccinated or not. I thought that was a pretty extreme editorial, but to be very clear from our side, the county has the vaccine. We have supply of it. We are distributing it in locations that people can go get it whenever they want if they decide to have it. And there's nothing holding people up on the county side for citizens to make that choice to get that vaccine. Is that fair?
As a broad statement, absolutely. We're concerned that maybe some working families don't have access during the hours that they're available, or transportation issues. So that's why we're trying to get out to neighborhood levels and look at where we can make sure it's accessible to everyone that wants it.
Which I think is good. Again, if we can just have the supply and give people the capability to get the vaccine if they want, that's fine. But if people don't want to have it, I don't think people should be held back on their employment and getting a paycheck. I think that's a little bit crazy, but okay, thanks.